Hey, Christina Card here. Going to talk about Cushing's. Cushing's is very common. There are more than 3 million cases per year in the United States. It's chronic and it can last years to a lifetime. It occurs when your body has too much cortisol over time, which can come from taking corticosteroid medications. Ooh, say that 5 times fast. Or your body producing too much cortisol. You can also end up with high blood pressure, bone loss, and sometimes even type 2 diabetes. The earlier you receive treatment, the higher your chance of recovery, though. Cortisol helps regulate your blood pressure, reduces inflammation, and keeps your heart and blood vessels functioning normally. Cortisol helps your body respond to stress, also regulates the way your body converts proteins, carbs, and fats into energy. There are many different ways that you can diagnose Cushing's. However, all need to be done by a doctor. So you can go ahead and schedule a doctor's visit and go in and they can do a urine and blood test. A urine test may require you to do a 24-hour catch, which means that you collect your urine for 24 hours so that the doctor can send it to the lab. They may also do a blood test, which can check your cortisol levels in your blood. There's also a saliva test, because people who don't have Cushing's, their cortisol drops at night. A person with Cushing's will have elevated cortisol in their saliva at the end of the night. You can also do CT scans and MRIs to check for tumors in your adrenal gland or your pituitary gland. There are many different signs and symptoms as well for Cushing's. Weight gain and fatty tissue deposits, usually around the midsection and upper back, specifically between the shoulder blades. This is referred to as a buffalo hump. There is also some fatty deposits in the face, which is called a moon face. You can also experience pink or purple stretch marks on your abdomen, thighs, breast, and arms. Some people with Cushing's also experience acne, thin or fragile, easily bruised skin. They have slow healing cuts, insect bites, and infections. In women, you notice thicker or more visible body hair, irregular or absent periods. And in men, you notice lowered sex drive, lowered fertility, erectile dysfunction. Some other signs or symptoms that might occur are severe fatigue, muscle weakness, depression or anxiety, loss of emotional control, cognitive difficulties, skin darkening. There are a few different treatments for Cushing's. They are all designed to lower the cortisol in your body, and the best treatment depends on what the cause of your Cushing's is. For instance, if your Cushing's comes from corticosteroids, my apologies, then your doctor may reduce your medications, but they will slowly taper them. You cannot abruptly stop your medications because this can cause more harm than good. So please do not try and do this on your own. Make sure you contact your doctor first and have them come up with a plan for you. If the cause of your Cushing's is a tumor, then removal by surgery may be the answer. After your surgery, you may need to be put on a cortisol replacement medication. You can take this for a year or longer and eventually end up coming off of the drugs because your adrenal gland will kick in and assist with the hormone replacement. However, sometimes it is not possible to come off the replacement medication and it may be a lifelong drug for you. There is also the option of radiation. This can shrink the tumor in patients that can't have surgery or are not good candidates for surgery. You can also do medications. When surgery and radiation don't work for you, a medication may be prescribed for you to live with the disease. However, this is a lifelong treatment and you will have to take medications for the rest of your life. The different medications that may be prescribed to you are ketoconazole and midotane, which also control the excess cortisol in your body. This would be a good option for somebody who couldn't have surgery or couldn't do radiation. For people who end up with type 2 diabetes from Cushing's, as you heard earlier in this video, they may get Mifeprex, which reduces the cortisol effect on the tissues in the body. Many individuals go on to live with Cushing's. However, it may cause psychosocial disturbances in individuals like depression, anxiety, emotional irritability, apathy, and cognitive decline. This could in turn affect their family relationships, their personal relationships, and maybe even friendships. The person may experience depression from an altered body image, and they may also experience the anxiety on how others may view them or see them. Your self-esteem may be affected, and they may be short-tempered because of always being on edge. You can always go on to live with Cushing's. However, you will need extra support and extra help through these times. There are many support groups, there are many coping strategies, and other things that can help you deal with the disease. Thank you for watching. I appreciate you dealing with my stutter, and I appreciate you dealing with me messing up.